Welcome to Louisa Mosen, a patient who has experienced COVID, which has then led to developing POTS. We also welcome Dr. Boon Lim, a consultant cardiologist and electrophysiologist at Imperial College, London and Hammersmith Hospital. Thank you both for joining us, and Louisa, a special thank you to you for sharing your experience. I'm sure many people will be very interested to listen, and also how you're coping. Mm-hmm. So, Louisa, would you like to begin by telling us, start at the beginning, tell us what happened?
Well, my partner went to an international event, and a few days later he came back and he had a high fever. And so we weren't isolating. This was before lockdown. We thought, well, it's not COVID. I'm sure it's just like, I don't know, some sort of flu. And then he lost his sense of taste and smell, all the typical symptoms, although he didn't have a cough. So obviously we weren't isolating. And within a few days, I started to feel, I was writing emails and I was like, why? I felt this brain fog, like I couldn't write an email. It was really weird. So I went home to work from home, and then I started getting this scratchy throat. And then this is March 10th. Overnight, I was very achy, very, very fluey, had a high temperature. And then from then on, for about 2 weeks straight, I was bedbound. Complete loss of sense of smell and taste, a lot of gastro issues. Yeah, so it felt like the flu basically, but it felt like I couldn't move, like hugely fatigued. And then after about, I think it was like between 2 to 3 weeks, I woke up actually feeling better. Like I had a zest for life, and I was feeling really like, oh, it's gone, great, because I was getting a bit worried that it was lasting longer than 14 days. And yeah, so I felt better. I skipped to the shop, I was dancing around the room, I felt very normal. But then bam, that night I was vomiting, temperature came back. So I'd say I'd had about like 4 or 5 hours of feeling normal. And then that evening I was back in bed. And then for about 2 more weeks after that, although I wasn't bedbound, I couldn't really sit up much. I was lying on the sofa, and obviously I wasn't working at all throughout this time. We were both quite worried as well. We were wondering why it was lasting longer than 14 days. And my partner as well, although he'd mostly recovered, he was having breathing issues, which for him lasted up until about 8 weeks. And we're both, sorry.
Did you go to a hospital during this time, or were you just trying to deal with it yourself?
So I called, I can't remember, I think at the beginning I called the doctor, and I was just told to stay at home, and all the guidelines on the 111 on the site said if you're not, blue in the lips or having a seizure or anything, you need to stay home, and that's it. And at this point, I wasn't having breathing problems. That was later. So yeah, I was just told to stick it out at home, which was obviously quite worrying. So there was a lot of anxiety around that time. So yeah, and I'd say about 6 weeks in, my lungs and my back, my back burning quite a lot, and then I started getting shortness of breath, which was obviously quite scary. I didn't go to the hospital because it'd always come back. It would last maybe about 5 minutes and then it'd stop. It wasn't very consistent. But yeah, all the other symptoms are still there, apart from the high temperature. Instead, it was fluctuating kind of hot temperatures, like hot flushes all over my body, which have only started to go until recently.
So I'm going to stop you there and try and pick you up, Lou, because I think there's some really interesting points here, which I'd like to share. So you came to see me in August, which is very much later on, after some more symptoms, and just before you go on to talk about the symptom evolution, it is very interesting to me that actually in the thick of COVID, when you were having the worst of the COVID illness itself, You described losing your taste, your smell, having a temperature, being bedbound, very, very achy. But breathing wasn't such a big issue then. Is that right?
Yeah, yeah, it's very strange. It was about 6
Yeah.
weeks afterwards. Yeah.
Yeah. So this is something that I like to share with patients, because the story is interesting. People think COVID at the early stages should affect your breathing, and it's one of the major things with cough, lung fibrosis, lung inflammation. But clearly, you escaped from that, and it's my belief that actually the initial phase of COVID for you was a relatively severe flu-like illness, but without much pathology in the lungs. And I guess what I'd like to know from you is what could have been going through your head when you then became short of breath? Because it doesn't quite figure, right? That you get the worst of the COVID in the first 2 weeks, have a period where you're maybe improving or convalescing or resting, only to get more breathless afterwards. What did you think about the breathlessness that occurred after the 6 week or 8 week period?
I mean, there wasn't much information online about getting it longer than 2 weeks, and I wasn't in a support group at this point. So actually, it was just panic, and I thought, have I re-caught COVID? Why are my lungs suddenly playing up now? When there was I didn't even have a cough. I had a scratchy throat at the beginning. There was no cough though. So I thought, am I slowly dying? Like there was every thought going through my head. But then seeing my partner who had breathing problems a few weeks down the line as well, we were kind of in sync. So that kind of reassured me but then I thought, well, maybe we both re-caught COVID. It was really, really confusing. So yeah, and I did ring the doctor as well. So my lungs are burning. What should I do? Have you heard about this before? And he said, oh, I haven't heard about it, but I'll give you an inhaler. Which I didn't. I've got it, and I never used it. It didn't feel that it was going to help. So yeah.
So in knowing your story, can I just ask you more about the other symptoms that could have come on with the shortness of breath after 8 weeks? So for example, can you speak to us about the palpitations and maybe the chest discomfort that you started to experience?
Yeah, so I started to have a very weird feeling, like something was, I don't know, racing in my body, and I had lots of adrenaline rushes. I wasn't sure what that was. I thought, was it because I'm not moving enough? Because obviously I was like less than 500 steps a day. I was hardly moving in the house. And yeah, the heart palpitations came on a bit later. So yeah, I would get heart racing where I couldn't talk when they were going on. It felt really intense. I had heart spikes up to, I think it was 160, 150. I didn't check all the time, so it could have gone higher for all I know, but it felt quite frightening. And then I had a lot of chest pain and chest tightness as well, and that was also later.
So how late? I mean, if you can think about how many weeks or months following the initial COVID diagnosis or symptoms?
Yeah, so I would say the chest pains probably started at the same time as the lungs, maybe 6 weeks in, and then shortness of breath was intermittent. But the heart palpitations, I felt like I noticed they were more prominent in maybe the 3rd month. Yeah.
So we're going now to June, July, that kind
Yeah.
of time, where the palpitations were quite dominant. And just to pick up the shortness of breath symptoms, did you feel that standing up was a chore? And was your best position at home in the couch or on the bed? In terms of your comfort level?
I was very lucky I had a partner who looked after me, because I couldn't even make my own breakfast. I would stand up and I would have to sit down because I got very woozy. It was just, I couldn't explain it. It was just this weakness and wooziness, and it wasn't dizziness or lightheadedness at this point either. That kind of came a bit later as well. But I couldn't stand up. I was basically, on the sofa behind me all the time.
Okay. And then I guess I might take this opportunity to say now that you came to see me, Louisa, on the 14th of August. And at that stage, we had a conversation, and I asked you the questions that I've already asked during this afternoon session. And then I went along and did some testing on you. And one of the tests that I found incredibly instructive, which I think was also helpful for you to see when you came to see me for review, was the tilt table test.
Yeah.
And actually, just to highlight to everyone, I have your tilt results, if you don't mind me sharing it
Oh, absolutely.
with
Yeah.
the audience, because it's incredibly instructive. So I'd just like to point out that actually Louisa has a very typical long COVID profile. And since tilting you, I would say that I've had several other tests, tilt tests performed on maybe 15 to 18 more patients with long COVID.
Right.
And we have now recently got accepted for publication in Clinical Medicine, the journal or the article entitled Autonomic Dysfunction Following Long COVID, which I think will be out in press hopefully soon within the next month. But it encapsulates all of those symptoms that you're describing. And here I take some time to show you, first of all, what a normal patient's tilt might look like. So this is a tilt table test. I don't think I showed you this when I met you in clinic.
No, I haven't seen
but
this. No.
just for the sake of showing the audience, a normal tilt test will look something like this, where on the first 5 minutes in the supine position, here, what we get is when you're lying down, your blood pressure is pretty steady there, let's say, not you, but a different patient, 140/80 with a heart rate there seen at, say, 70 beats per minute. What happens in a hit-up tilt scenario, so that's when you remember being tilted upright here, just as the figure shows, is that the blood pressure can drop just transiently, and then we have a very mild adrenaline surge to try and boost that blood pressure, which is starting to fall with gravity into your lower limb vessels. And this increases the heart rate ever so slightly, say to 80 or 78 beats per minute. And this normal variation by about 10 to 15% increase in the heart rate is very normal. And this is something that continues to happen. There's a blip here, which is interesting. I won't focus on that. But at this point, at 20 minutes, GTN is given. GTN is a nitrate that forces further vasodilatation. So it causes your lower limbs to expand further. And in doing so, it tries to drop your blood pressure, empty your heart. But in this particular patient, there's a nice adrenaline rise and the blood pressure is maintained, and it maintains pretty steady throughout, although the heart rate rises further with GTN. This is a normal pattern. So Louisa, this is your pattern. And in your pattern, it's a pattern that I've seen reproduce in so many long COVID patients. So these are tilts that in 3 and 6 months after, which is why I've now got a case series that has been accepted for publication to educate public and to let people know why it is they may be getting all the symptoms you described. So if this is your baseline on a 5-minute interval, this is how you were. You can remember the previous blood pressure, very stable, is almost like your pattern. So whilst you're lying down, guess what? You're exactly like a normal patient with a heart rate baseline of 80 and the blood pressure that doesn't oscillate that much. But look what happens here. The moment you have a hit-up tilt and you go into this position, what you did was you shot your heart rate up from 75 to the maximum of 122 beats per minute here. And mirroring this heart rate oscillations, as you can see going up and down, are the oscillations in your blood pressure. I don't know whether you can see them now. These oscillations occur in 10-second cycles, what I'm drawing here, because each of these bars is 2 minutes long. So if you count, there are about 12 oscillations per bar. And these oscillations bring your blood pressure anywhere from 120 down to 82, let's say, on the systolic or the high blood pressure reading. Now, these kind of yo-yoing patterns is extreme adrenaline overload. And your adrenaline is trying to maintain your blood pressure, pushing it up here. When you get to this nice steady blood pressure, the adrenaline reflex or cycle mediated by your baroreflex, which are 2 very sensitive receptors in your neck, then shut down. The adrenaline plummets and off your blood pressure goes down again and your heart rate goes down again. And guess what? When your blood pressure and heart rate go down, what happens to the adrenaline? It cranks up again and therefore you get the repeated cycle on and off, on and off, on and off. Yes? And this explains why coming to this point, even before the GTN was given, GTN was going to be given about here, you couldn't tolerate the test anymore. Can you see
No.
this? This point,
Yeah.
your blood pressure is saggy, and you remember, maybe you can tell us what you felt at the latter stage of tilting.
Oh yeah, I felt absolutely awful. I hadn't fainted at all throughout long COVID, but I felt like I was going to faint and vomit. I have felt faint, but I never got to the point of losing consciousness, and it was horrible. I don't want to relive that. It was a horrible feeling.
So this experience that you had on tilt actually was starting to drop your blood pressure here to a low of about 82 over 55, something like that. And your heart rate, you can see here, was starting to dip. And this is the opposite effect of what it should be doing. You should be pumping adrenaline to try and keep the blood pressure up. And this is at which you're getting a bit exhausted, or your autonomic nervous system is getting a bit tired of fighting. You see what I mean? And therefore your blood pressure is falling. And had we not tilted you back up to the, or down to a flat position at this point, you became flat again, your blood pressure would have probably continued to drop. The other thing to say here is how rapidly you can recover your blood pressure. Can you see within 1 minute, your blood pressure is stabilized back to baseline, and you get rid of these yo-yoing oscillations. You come back to a steady heart rate, just as it was in the start. That explains why you love, or why you have loved lying in your sofa or couch or bed.
Yeah.
Because can you imagine, whenever you stand up or have stood up in the 6 months post-COVID, you feel like this, with this kind of physiology. So the thing that I wanted to point out is that it's not potentially all in your head, not that you ever thought it was, but there are some patients, unfortunately, who are told that your lungs are fine, your saturations are fine, and you know what? If the blood pressure was taken, even during the time of the oscillations, with a single reading in your forearm at your GP, guess what the reading might have read? Normal. You've seen it.
Yeah, I got that. Yeah.
Yeah, it oscillates, but the blood pressure would only ever pick the highest reading, which is 120 over 80, which is considered normal, right?
This is one of the problems. I've obviously in that I'm in a community group for people with long COVID, and they get told they get all their vitals done at A&E. As I actually went to hospital in June, and I was told everything was normal, and I was just told to wait it out. Obviously they're not equipped with the information at that point, but they took my blood pressure laying down. Everything was fine apparently. Yeah.
Well, and so it would look fine, but actually you need that detail, kind of beat to beat measurement to understand this. But actually, now that you know, I guess you have very kindly agreed to be an ambassador here to share your story, and we're all very grateful, because really what your story encapsulates is the fact that even after the acute COVID situation, 4, 6, 8 weeks later, sometimes 6 months, 8 months later, people who haven't done what you've done to recover from it, and we'll talk about that later, are still struggling. And of course, there is a philosophy: the longer you stay in bed, the longer and more comfortable you are lying flat, guess what? You won't recover. It will gradually progress, and you'll gradually be more physically deconditioned. And so whenever you stand up, the situation will only worsen. We were meant to be bipedal, upright mammals. That's what we are. And we're not meant to be lying flat. And in fact, interestingly, your physiology can be reproduced by astronauts in space. If you went to a zero gravity environment and you spend 60 days in orbit and you came back to Earth, you might have the physiology that you demonstrate. And actually, long COVID or short COVID, the immediate COVID, is a very, very strong gravitational or anti-gravitational challenge. Because guess what? When you're out with the acute phase COVID that you had in March, you're in bed, you're dehydrated, you're not keeping fluids in. And so your blood pressure is starting to be challenged by this virus and by the illness process. And what we're starting to understand is there may be some direct autonomic effect of the virus on your brain, on your vasculature. although we're finding it difficult to distinguish between that physical deconditioning and a lack of understanding to know how to recondition yourself after COVID.
Yeah.
So I think it's very helpful to see those blood pressure traces. The other thing, if you allow me to share, is something else, which is to do with the physiology. Now, if I showed you this diagram, I think, Louisa, you might have seen this in clinic with me, correct?
Yeah, that was helpful. Yeah.
Yeah, so I'm just going to show it for the audience here. Imagine you have a circulating volume here of, let's say, 5 liters going around in red, and you have a normal blood pressure when you're lying down. Now, when you first stand up, what happens is the gravitational pull and the change in posture will immediately pull some blood down directly from your head and your heart into your lower limbs, which are very large reservoirs of blood. So what I'm going to illustrate here is that this blood is channeling downwards, filling your lower limbs with blood. And your blood pressure, therefore, has gone down from a normal to a slightly low blood pressure state. Now, what happens to explain all your 3-month symptom, Louisa, is your baroreflex, which is 2 organs in your neck called the carotid baroreceptor. And these are the reflex organs that sense your blood volume, will sense that you have less blood coming through, less blood pressure.
Yeah.
And that immediately sends an impulse to the brain to say, hang on a minute, my blood pressure is low. Let's push it up because I might be in a danger situation. I might pass out. And the response that your brain gives is actually a flight or fright response. And that fright response is mediated by adrenaline or epinephrine. This adrenaline surge is the exact words you use. I felt like I had a lot of adrenaline. What does it do? It increases the heart rate. It also increases the heart contractility. And in doing so, it causes the heart to demand more oxygen. Now, there's nothing wrong with your blood supply, your blood pipes, but the fact that your heart is beating continuously, quickly, and strongly means that it's extracting as much oxygen as it can. And at some stage, the fatigue in the heart can lead to this kind of chest pain that you've been experiencing.
Oh, right.
What does adrenaline do? Yeah, what does adrenaline do? As a reactive hormone, as a stress hormone, it wants to prepare you for running from that saber-toothed tiger that's just jumped out of the cave, or a bear, or a very strong stressor that's about to end your life. And what you have to do is prepare your muscles for running. So what it does is it shuts down your gut. And here I didn't ask you about any gut symptoms you might have had, like constipation or diarrhea.
Yeah.
But it also will lead to you having an increased respiration rate. And the reason that is you need to flood your lungs with oxygen to take away oxygen to feed your muscles, which are about to run for your life. Now, this is an explanation for why you might have had that panting kind of shortness of breath, which in your experience, maybe you can share with us, was a lot worse when you stood up or started to walk around. But interestingly, when you lay down, maybe it took a minute or 2 before your breathing then settled. That's very, very much keeping with this process. And then lastly, adrenaline also actually modifies your temperature and sweating.
Yeah.
And I don't know if you had lots of temperature changes and feeling hot and cold.
Very much so, yeah. Yeah.
Yeah. And then the other point to make is if you shoot across now to the other side and you say, what is the impact of adrenaline on vigilance? If you imagine you're running from the bear again, or you're a gazelle grazing in the savannah waiting for that lion to come, the moment you hear that swish of grass, you become hyper vigilant. Your ears prick up, your sight and vision and sound becomes very reactive and responsive. And that is the impact of adrenaline in preparing your brain. So a lot of patients who come back with the symptoms you describe of palpitations, shortness of breath, temperature dysregulation, bowel dysfunction, and hypervigilance, or some would call anxiety, are labeled with anxiety, which is very unfair in my opinion.
Yeah,
This
yeah.
is all explained by the physiology at play here. And the good news is that there have been specific strategies for you to get back to a much better place. Come back to you and ask, how have things been, and what have you done to try and get better and get back to work?
Well, since I saw you, I did the self-treatment kind of plan with the compression. So I bought compression tights, originally just thigh high, and I've now evolved to leggings, waist high, which stopped, as we were just talking about the bowel discomfort, that's all stopped now, which is amazing. So yeah, I was wearing compression, experimented a lot with that. It was quite uncomfortable. It felt like also like a new world to learn about POTS. But yeah, so I was doing compression, and I used electrolytes, 10 grams of salt a day, on my food and in water. And I also did a lot of, trying to walk more, because at that point when I saw you, I was maybe walking 20 minutes, but very slowly, and I would often see an effect afterwards. So I gradually started to build up my walking after kind of like 2 weeks after I'd used the compression to support my body felt a bit stronger. And it took a while for me to see an effect actually from the compression and the salts and the electrolytes, but I was quite religious with it. So yes, I gradually increased my walking. Before I'd be walking, less than 1,000 steps a day, and now I can walk 13,000 steps and I'm fine.
Wow.
So
Amazing,
yeah,
Louisa.
which
Amazing.
is very good. And another thing I did a lot was as well, because obviously you can do a lot of doom scrolling online, like making yourself feel worse about your condition, thinking it might be forever. I did try to address the mental health side of it, did a lot of meditation, tried to kind of process difficult feelings, such as grief, mourning my old body, all those sorts of things. And also, like you said, about the anxious feelings that come with the heart palpitations. Yeah, that was obviously quite difficult. So meditations did actually help that. I did like tapping, EFT, daily, trying to tell myself, like, just because you can't see healing doesn't mean it's not happening. All those sorts of trying to be as positive as I can, whilst also trying to process the difficult emotions. So I'd say the mental health side of it also really has helped me, and also having a supportive partner and a supportive workplace. And I think that's quite key.
So I was very interested when I first met you. I mean, on the second time we met, you talked to me about your interest in the emotional freedom technique, or EFT, and tapping, and you showed me how that works. And I have a very open, and as a cardiologist who sees many patients with syncope, orthostatic intolerance, and even POTS, I really do value and actually think that a critical component of patients' well-being is their mental health, and being acknowledged as having an illness with first of all, a non-mental health basis. So I'm not saying that we focus on mental health because you have a mental health illness. Yeah. That's very, very important. And I hope when we spoke, you realized that I communicated with you on a, if you like, organic basis. I was demonstrating the physiology to you, but actually I'm rejecting what you've said to me about the EFT, because I didn't know much about it, but I have an open mind. And if it works for you, just like some other techniques, deep breathing exercise or meditating exercises can work for others, it doesn't really matter. What matters is that you can dial down your adrenaline response through whichever technique you use, and you've done incredibly well. Not many people know the emotional freedom technique or tapping. Some other people might go into a YouTube video or an audio track using one of these apps to try and calm the respiration. I can't remember. Can you just remind me, did we talk about breathing with a biofeedback tool called HeartMath? Did I show you this?
No, I haven't heard of that one. No.
Okay. I mean, this is a biofeedback tool that I've started to use myself. I have a very busy and stressful life, and It's a Bluetooth thing that you can just put on your ear like this.
Oh, you
And if
did
you
show
turn it
me.
on,
Sorry. Yes, you showed me
yeah,
it.
yeah.
Yeah.
So this is something that I found very helpful in helping to entrain your breath, and through the breathing, cyclical, slow breathing, I think it's a window into the parasympathetic or vagal activation, and that is the direct opposite of the adrenaline response. So part of the component of healing in the long COVID phase, in addition to everything we've talked about, is also to focus on mental health. And the thing you've done brilliantly is you've gone onto Slack, you've got a great mindset for change. And I want to showcase you as a patient who's done the incredible things that are needed to do, and the resilience and persistence with the fluid, the salt, and the compression. As you say, it didn't happen overnight. You took some time to get to a stage where you are now. But if I look back at your journey from 500 steps to 13,000 steps, it's incredible that you've taken such a long time.
Yeah, so you're right.
It is a slowly approach.
Yeah, it was very much trial and error, and I obviously didn't see results straight away. There's a lot of patience with it, and I'd say it was kind of just one step at a time. Obviously, it was a bit overwhelming at first, all the things I had to do. And sorry, I forgot to mention fluids. Obviously, 3 liters of water a day. I made sure I'd have that. So it took about maybe a month and a half before I started seeing real progress, and then it's just gone up and up and up since there, really.
So can I give you one bit of good news as well? I seriously doubt you have POTS, and I know you've had the label of POTS because I labeled it on the tilt table test. But you are one of those wonderful patients who I think will work your way out of that diagnosis, because when you stand up now and you move around and you're not symptomatic anymore, and your heart rate doesn't jump up by more than 30 beats a minute compared to sitting, it doesn't. You don't have POTS. So here is the situation. COVID has created a transient, what we call in medical terms, POTS phenotype or POTS-like symptoms, but it doesn't mean that you're stuck with that diagnosis forever. Do you understand?
Yeah.
And it's uplifting, because you don't have to go on the POTS forums or websites and say, oh my goodness, this is me, because it's not you. You've recovered. Long may it continue.
Yes, and actually you telling me, you weren't going to label me so much as having POTS because of the label and what I might see online, really helped open my mind to other kind of modes of healing, thinking I can get better in my own way. This is a unique situation for me. Doesn't mean because this person took, 15 years to get out of it, doesn't mean I will.
Exactly.
So that was really, your positive outlook really helped me and my partner through this, actually. So
Fantastic to hear. Can I just ask, what are your top 5 tips for people not in the acute COVID phase, but let's say 3 months after COVID, who are not really getting back on your feet again and experiencing some of the symptoms that you have? From knowing where you started, you were quite lucky to be able to seek out somebody who knew a bit about autonomic physiology in me, for example. What about the people who may not have this opportunity to have a tilt table test or to get the advice? What would you say to those people?
I would say if your symptoms are, first of all, join support groups so you can kind of see where your symptoms are. If they do, it might not lay with POTS, but if their symptoms are quite similar to those of what I had, consider that as an option, and follow the protocols with I'd say the electrolytes, compression. I mean, it's not going to hurt to try, except with the salt, I'm not sure, because the salt could, if you've got high blood pressure, then it might be a bit difficult with that one. So I would say do as much, research as you can into what you think you may have. Really don't give up as well on searching for somebody that could possibly see you, like to find you, Dr. Boon. I was researching kind of all day who to see, and that research paid off. But anyway, I would say follow those main things about compression, and also completely consider the mental health side of things as well. Really give that attention if you can, and if you can seek support, reach out to people. I actually got some, therapy on, it was like some free sessions, luckily my work offered me, which really helped with my recovery as well. But so yeah, I would say obviously try and work out what you think you may have, and if it does mirror POTS, I would definitely follow the self-treatment plan that I did. And with exercise as well, just want to point out on that, it's obviously very important to gradually build up, and I found it was very much trial and error. Sometimes I would feel worse afterwards, and if there wasn't like a 24-hour bounce back, I'd know that was my tolerance level, and I'd have to carry on maybe for another 2 weeks like that. So I'd say don't be...
Fantastic practical advice on the exercise. So people often ask me, how much do you exercise? And really what you just said encapsulates what you should be doing. If you exercise and you're flawed for the next day or 3, that's too much. And you need to exercise to the level where you feel comfortable exercising, but then not really be flawed the next day and still be able to carry on that same exercise the next day. If you're doing any more than that, you're probably doing too much. So this pacing and expectation in your mental state, i.e. don't be disappointed in yourself if you have a bad day. In fact, just back off and then try again. The thing not to do is to say, I can't exercise and stay in bed for the next 6 months. So this is kind of the dynamic push and pull that the mental resilience will get you through. If you didn't have the resilience,
one of the things I read, because obviously I found it quite hard with that up and down relapsing of feeling like I was getting setbacks. Right. I read something like, don't bully the process, and that really stuck with me, and that this is the process, this is teaching me my tolerance levels, all part of the healing journey, as difficult as it is. But with the exercise tolerance as well, obviously if you've had long COVID, your body has been deconditioned, and looking up reconditioning exercises, which you can find on online for POTS, which I have now started following, is definitely crucial. Just don't give up, and make sure you try and do small movements at least, because I started off with just a 2-minute walk around the block, and the little things can make big changes in the long run.
Louisa, it's incredible your sheer determination, how you got through it, and as you say, you were barely doing 500 steps a day, and now you're doing way in excess of 10,000. It's incredible, and I think you'll be an inspiration to others that maybe are still going through COVID long, and also, as you say, contacting a support group, not feeling alone, especially now when we're all in lockdown and can't see family members and they can't come and support you. That I think it's so important, and thank you so much for sharing your story with STARS and the wider audience, for all those that contact us, because I think it's a real encouragement to others that not everyone will be able to recover as much as you have, but to know that it is possible, and not to just... I think Boon and Jenny will probably agree, it's the fact that you didn't just give up, you kept trying. So well done. How are you feeling now?
So at this stage now, so I'm feeling, I have minimal symptoms. The odd time I have I feel a bit woozy, but then it lasts for like a minute and then it goes. But most days I don't, I used to not know how I was going to wake up. I'd wake up nauseous, I'd wake up, I don't know, have diarrhea, I didn't know what was going to happen. And now I'm just building my relationship up with my body, and I'm trusting it now, because every day is consistent. I'm able to run out to the shop if I want. I'm not running and cycling, by the way. I'm still trying to build up my muscles and my legs, and recondition my body, but I'd say I can live a normal life now. I've recently gone back to work. Before lockdown I could see friends, I can enjoy doing things now. I feel like I could, because before as well I wouldn't even be able to listen to music, because it's like sensory overload. I had head pressure, and all the things that you enjoy are kind of taken away from you in long COVID. You can't express yourself the way you want to, because you're just staying still. So now, sorry, I'm much better, but I've actually just got a physio to help me build up again, to exercise properly. But I am expecting kind of, maybe a good 6 months before I'm really exercising. But the main point for me is that I go through days now with no symptoms, and I can walk and enjoy nature, and so yeah, it's a huge change from 3 or 4 months ago.
And I can say, in addition, Trudy, that Louisa's a different person. She's radiant. She's got a wonderful glow about her, and she's always been positive. But physically, she wasn't very well when I first saw her. But her color, I mean, you were slightly gaunt when I saw you the first time. But a lot of that has come back. You're plumped out, and actually, the most incredible thing about you is your determination. I agree with Trudy, and I hope that you, in sharing your story, can be an inspiration for so many other people to know that they can get better, because you won't be the last person to do so. So it's a great sharing session. We're all very grateful.
Absolutely. I love that you say you now trust your body, and you're not rushing ahead, but you are pushing yourself each day. And I think we're in awe of you. So thank you, Louisa, so much for sharing. And I hope we can keep in contact and continue in your recovery. And thank you, Boon, for the introduction, but also Louisa, for, you may not realise just how many people you're going to help by sharing this story, by giving them hope, by making them more positive and more determined. I always look for the positive in a negative situation, and we've all found ourselves in such a awful time with the pandemic, and sometimes some of your days it must have been so difficult to find anything positive, but somehow you've powered through it, even when your body felt as though it was giving up. So and thank you both so much.
Yeah, no, you're welcome. And I want to add as well, I wasn't like, there were days I felt absolutely hopeless, and I thought, this is me doomed for life. Like there were a lot of days like that, a lot of crying, a lot of it was very up and down. So but yeah, supporting my mental health is definitely one of the ways that I kept trying. And if something didn't work, I just think, well, try another way, and keeping that up. So yeah, not giving up really is very important.
I think that's important. Positive thinking, Louisa. And I think you probably are a great believer in positive thinking.
Yes,
Got you through on the low days. Definitely,
yeah.
Your partner and your family are very proud and very, very relieved. And thank you again. Thank you, Boon, for introducing us. Fantastic.
You're very welcome. Thank you, Louisa.
No problem. Thank you.